Hope you are doing fine as usual. This is Professor OJ, a health consultant from Greenwald International Business School and also an international and national trainer in our profession. Thank you so much for visiting this channel. In case it's your first time, kindly don't forget to hit that subscribe button, turn on the notification so that whenever I drop a new jam, you always get a notification about a new jam. And also don't forget to drop a comment at the end of this video. So today I want to share with you something very interesting, okay? And stay tuned because today's topic is going to be very nice. So this tutorial or this health talk today is about the bones. So people suffering from bone and joint care problems, today you get sorted, and I'm going to talk about it in detail. So we are going to talk about three things today. So number one is the type of joints and the type of bones. Number two is the diseases which are associated with the joints or bones, and number three is the solution. But before I get into that, as usual, 6 important or vital body organs. Number one is the heart, number two is the brain, number three is the liver, the largest human organ. Number four is the kidney. Number five is the lungs. Number six is the pancreas. So those are the 6 crucial human organs. So all my trainings are based in these important body organs. So when I talk about diabetes, talk about pancreas, and already there is a video about that. So today we want to talk about the bone and joint care package, which is also associated and connected to the kidney, which is the 4th important body organ. We are going to see how. Somebody is wondering, how is bone issues related with kidney? Today you are going to get knowledge. Then the second thing is about the 3 causes of diseases. Number one is excess. And in this today's package, we are going to talk about excess uric acid. You see, I gave you examples of excess cholesterol, and excess blood fat or LDL, cardiovascular issues, excess uric acid, gout, excess blood sugar, diabetes, excess heavy metals, excess old stool, and such kind of things. And number two is deficiency. So today we are going to talk about excess uric acid and deficiency of calcium or calcium. Pronunciation depends on how your English teacher taught you, whether it's calcium or calcium. So that one is the most important trace element, the most abundant, which is related and connected to your bone system. So welcome to Greenwald Bone and Joint Care Package Advanced by Greenwald International Business School from Professor OJ, a Greenwald International Business School, okay, and business trainer. Now, bone and joint care package, as the saying goes, that life lies in movement. So this one is a saying by someone called French. There's a French ideologist called Voltaire. And while rest breeds rust. So have you gotten that point? Okay. So life lies in movement, while rest breeds rust. So just like a vehicle, you see, if your vehicle is moving, then it will always be active. But once you put it in parking, it will start rusting. The body parts will stop operating. The same thing also happens to our body. So for each movement, you need to know that every time we walk, we dance, even settle into a chair or hug our friends, we are using our bones and joints. We are putting them into action. Otherwise, we wouldn't be able to eat, or let alone kissing our sweetheart. The average adult has 206 bones. Did you know that? 206 bones, and which meet at joints and form the framework of the human body. So this framework is what is called the skeleton. Okay, now let me show you how a skeleton looks like. This is the skeleton of your body, and this skeleton is divided into 3 types of joints. So these trainings are very much important, and they can be used in the trainings or health trainings, because the third cause of diseases in the world is lack of knowledge. So my duty is to make sure that I tell you what is excess in your body, I tell you what is deficit, and I give the information on how we can limit the excess and also supply the deficiency in your body. Now, one thing you need to know, as you can see from your screen, there are 3 types of joints. So the first one is what is called the fibrous joints, also known as immovable joints. This one, okay, like the skull, okay. So for instance, the joints between the skull are called the satias, because skull is to protect our brain. So the purpose of this skull is to make sure that it protects the internal organs within our head, that is the brain, and this is the immovable joint. Now the second one, as you can see from your picture over there, is called the joints which are slightly movable. Call them cartilaginous joints or slightly movable joints. Okay, it is the cartilaginous joints that take an example of maybe the ribs. So this one is a good example of the ribs that accommodate our lungs and heart, and also accommodate important body organs or important internal body organs, which is around the rib or the pretorium area. So the majority of joints is the synovial fluid. The synovial joints, which is freely movable joints. Okay, so that's the majority of the joints. So this one is just one, this one is just part, but majority, as you can see from the screen, we have this one, we have here, we have the knee, I think this is the knee, we have the elbow, we have the shoulder, and also other parts. So that one is the majority of the bones. So they are freely movable joints, such as the knees, as you can see. We also have the elbows, ankles, and knuckles. So this type of joints is the main target of arthritis. And when you talk about arthritis, we are going to see different types of arthritis, so that whenever you are going to treat your arthritis, specialist should not just tell you have arthritis. It is important for him or her to specify which one do you have, so that you can have better treatment. Okay, so the one which is called arthritis, because they are for movement, and once they are attacked, then what will happen? Then you'll have pain, you can also have limitation of movement, and probability you can also be disabled. Disability can come there. So this arthritis affects those 3 things. So the first signs and symptoms of the disease is the pain, then limitation of movement. That's why you find people with arthritis have a problem with movement, and at the end of the day, they can also be disabled. That is okay. Now the next thing I want us to check is how important are our bones. How important are our bones? So the bones plays 3 important body functions, as you can see, to protect the internal organs. Number 1, note that one down. Number 2 is to function movements, and number 3 is the bone marrow, or the marrow that produces the blood cells. So one thing you need to know is we need bones and joints to carry on vital activities. First, as you can see, they protect internal body organs of the body. So the good examples are skull and ribs. The skull protects our brain, and the ribs protect the internal organs like the heart and also the lungs. Okay, so skull protects the brain and ribs, then create a cavity that protects heart and lungs. So the second function of joints is to carry out motion, or that is here we say to function the movements. Okay, so in depth. So that means without bones and joints, even nodding is impossible, because you can, for you to nod your head, bones has to move. For you to walk, such kind of things can be affected. And last but not least is the bone marrow, which is located within the spongy or the cancellous portion of bones, and its function is to produce blood cells. So those are the 3 functions of bones. Now, bone and joint care can be sick, and once they are sick, that means the body is not going to operate normally. And we have 3 diseases that affect this one. So we can see from the slide that the bones and joints play important roles in human body, and if we do not take good care of our bones and joints, then they can be sick. So in today's section, we are going to talk about 3 types of bone and joint diseases, and they are osteoporosis, So we are going to discuss more about osteoporosis and to understand it better. Then we are going to talk about arthritis, and we talk about arthritis, the two types of arthritis, that is rheumatoid arthritis and osteoarthritis. Then we are also going to talk about gout. Okay, gout. Now let's start with the first one, osteoporosis, from the word porous bones or weak bones. Okay, now mostly you find this one is caused due to calcium deficiency. When there is a deficit of calcium in your body, your bones become porous. This is a normal bone with small cartilages, mashimo ndogo ndogo. Now this one is a porous bones. Calcium deficiency, the bones become fragile, they become weak. Okay, I think you've ever come across a bone of maybe a jaw of a cow, maybe a bone of an animal that was slaughtered and have stayed for long, or maybe in water. You always find that it is light and it can easily break because of those conditions. Now let's start by knowing what is osteoporosis. Osteoporosis, from the word porous bones, due to calcium deficiency mostly, is a silent killer in men and women, especially those who are above 50 years and above. So those two pictures, as you can see, of the bone structures, the left is the normal bone, this one is a normal bone, and the right one is the abnormal bone, which has a lot of holes. You see, this one has small holes, this one has a lot, and minor, that is the major holes. Now osteo, the word osteo, this one means bone. Osteo just means bone. Porous means holes. So when you talk of osteoporosis, it means bones with holes or bones which have larger holes. Okay, yeah, so osteo means bones, porous means holes. So if you are told you have osteoporosis, it means your bones are having large holes. So the combination of the two words stand for disease when the bones have many holes and become more fragile, meaning they become more weak. So it is the most common reason for a fracture among the elderly. Though wale watu wenye wanashuka kwa gari, then ukiteguka kidogo mifupa inavunjika, unaekewa fractures, such kind of things. Those are the things that we are talking about. Now it is the most common reason for a fracture among the elderly, as I've told you, and what is more, it is more common in women after menopause. Mostly, why do you say women after menopause? Because remember, calcium is always 99% bones, 1% blood. So because women go for periods every month, so they always lose the 1%. So mostly there is a borrowing from the bone. So that's why most of the osteoporosis affect women more than men. Okay, and because with the decrease of estrogen, the reabsorption of bones overtakes the formation of it. Reabsorption overtakes the formation, and that's why our osteoporosis takes place and develops. Okay, and in men it occurs anyone when too much calcium is removed from the bone framework and the bones become brittle and fracture more easily. So generally speaking, you find that half of women and 1/4 of men above 50 years may have osteoporosis, and it may significantly affect the expectancy and quality of life. So that means, and one thing you need to know, that calcium depreciates from the age of 20 years. So from the age of 20 years, it is important people to supplement calcium. Now we are talking about deficiency. You see, the root cause of problems. So someone with osteoporosis, we are going to see how we can solve this. Okay. Now each year you find that hip fracture caused by osteoporosis leave numerous survivors in their wheelchair with permanent disability and dependency. Okay, meaning that this person was working, and now because he cannot walk anymore, he has to depend, or she has to depend on a donation and children. And 1 out of the 5 elderly who break a hip die within 1 year. So it is very serious. So moreover, this is a costly situation, and mostly in countries like China, you find that an average cost of a surgery for administration of a hip fracture is around $2,000 to $4,000. That's very expensive. Okay, very expensive. Now well, let's talk about fracture caused by osteoporosis. There are two types of fractures. We have one from a fall. Maybe you fall and then you break a bone, and then we have another one from compression fracture. Okay, now I want us to take these two serious types of fractures. So the left picture from your screen, the left picture is the femoral neck fracture, and the right one is called the vertebral compression fracture. when you talk about vertebral confraction fracture, if you've ever watched a movie called Naked Weapon, there is a movie called those movie fans, if you are a fan of watching movies, you can understand Naked Weapon. So there's a training those women on how to break have to cause a compression fracture within the backbone and make someone leave the earth or die. So maybe if you watch that, you can understand how that backbone can be pressured until it breaks. Okay, now fracture can be caused by fall over. Okay, as you can see from your as you can see from the left picture, and from the right picture, it can be caused by what is called internal force. Now, for example, compression from the right picture, you can see, is an internal force. It is just like when a mountain is covered by too much snow. I've given you a good example of that movie called Naked Weapon. If you've never watched it, go and watch it to understand when I talk what I'm meaning or what I'm talking about. So so the weight of the snow becomes too heavy that it can cause a snow slide. So just like the triangle diagram has shown from here, you can see there is a fall, force, fracture, and also the fragile that is. So once our bones become fragile, either fall or the force can trigger what is called disastrous fracture. Okay. Now, bone formation and resorption. Bone formation means how bones are being made, and bone reabsorption is how the important elements are being absorbed within the bone. So normally you find that fracture occurs in elderly, just the way we have said, especially 50 years and above. And youngsters seldom have the same problem. So what is behind this phenomenon? In other words, what causes osteoporosis? Then we must be aware that our bone is a dynamic structure that is continuously being broken down and restructures. It is broken down and restructured. That's why you find that when a kid has a bone fracture, akiwekewa plaster, then the bones can reform again and come back to normal. But an elderly person, it might be a bit difficult. So bone is not a finished building. It is a building under constant demolishment and rebuild. That is one thing you need to know. Okay, so this sounds strange, but it is true that up to 10% of all bone mass, by undergoing remodeling at any point in time, now there are two types of cell responsible for the process, and they are doing the opposite things. Now we have osteoclast, this one here, bone resorption. Now talking about bone resorption, and osteoclast, rancle, and osteocytes. So that is what we are talking about. So osteoclast cells are dissolving and reabsorbing the bone. So they are the demolishers of the building. So that is what they do. Their main purpose is to make sure that they assist in demolishing the building, that's the bone. Then we have the osteoblasts, on the other side, bone formation now, or the osteocyte down there. Okay, so the osteoblast cells are forming and depositing the bone, so they are the builders. So these ones are demolishers, these ones are the builders. So osteoclast, as you can see, bone resorption, and osteoblast cell bone formation. So these ones, this one rebuild, this one demolishes. Now let's take a good example of bone formation and resorption with age. So as you can see from your screen, you have this kid, this is a middle-aged person, and this one is an aged person. So we are going to talk about the bone formation in all of them, then bone resorption in both areas. Now let's start with a baby. Now a baby is small, and a fully grown teen is as tall as an adult. So this tells us that when we are young, the builders of the bone must be more than the demolishers of the bone. The builders of the bone resorption must be greater than the bone formation. That is another point that you have to know. That is okay. That is to say, the formation of the bone must overtake the reabsorption of the bone, and this one takes place from the age of 20 to 35. There is a balance between bone reabsorption and formation, and during this time we keep steady bone density. Okay, so after 35 years, the balance is once again broken, so the bone reabsorption overtakes the bone formation, and we gradually lose bone density until it becomes fragile. So this is when we suffer from osteoporosis. So that's the origin of osteoporosis. Anyway, these are complicated things that maybe somebody with arthritis or bone issues might know. What is important is to know the solution. When you visit us for a computerized full body diagnosis, we are going to check the calcium deficiency, we are going to check the bone density, we are going to check the osteoblasts, the builders and the demolishers and everything. Then from there, it will be easy for us to know how to recommend the right medication. But just know that before we recommend any treatment, we have to detox your system. Okay, because we have so many people who prescribe like calcium to patients with osteoporosis, but now they end up reacting negatively. Why? Because calcium cannot be absorbed when there is a lot of toxins in the system. That is one thing you need to know. Now, what is behind the imbalance of bone formation and reabsorption? So one mineral that plays a critical role is the calcium. So I've talked about this one. Calcium deficiency simply is the major cause of osteoporosis. Now, calcium is one of the essential raw materials of bone, and inadequate intake of it from food or maybe lack of vitamin D deficiency. Now, see, now we are talking about deficiency. Causes of disease is very important, or decrease in estrogen in women sometimes, or maybe lack of physical activity. When I was talking about 4 things for you to get healthy or to be healthy is about regular exercise. Very also good for your bones. Sorry. So those are the things I'm talking about. Okay, so sometimes even heavy use of caffeine or alcohol can increase bone reabsorption and decrease bone deposition of new bone. So in addition, what happens, advanced kidney failure also contributes on an onset of osteoporosis. So we need to know how we can prevent osteoporosis. You see, now kidney is now associated there, and we are going to see how we can prevent this. Okay, we are going to know how we can prevent this. Now, how do we prevent this? That is the first question that we need to ask ourselves. In simple terms, how can we prevent osteoporosis? Now, first, we have to prevent calcium deficiency. And the only way we can prevent calcium deficiency is by making sure that we supplement enough calcium to the body, especially to the elderly above 50 years. Okay, and that's why we have what is called the RDA. RDA means recommended dietary allowance. Yeah, something like that. Recommended dietary allowance on a daily basis. So it is different in different people. So you find that in an adult male, you need 1000 milligram per day. In an adult female, also needs 1000 milligram per day. Now 1000 milligram, if suppose we compare it with milk, we know that milk has calcium, though it doesn't have enough calcium because the important part has been eliminated. We only take something else. You need like 8 glasses of milk, raw milk, for you to get 1000 milligram per day. 8 glasses. And 1 glass mostly is 500 ml. But what happens in our homesteads? We buy a packet of milk and we prepare tea with it, and then we drink it like 5 to 10, between 5 to 10 people. Maybe let's say 5 people. 5 people. That means you don't even take a quarter, even a half, even a tenth, even an eighth of the milk from that. So that's why people are aged need to supplement this one. Now, female after menopause, that is 50 years and above or 45 years and above, need 1200 milligram per day. So this calcium or these products that I'm going to talk about are good for your grandmother and also your grandfather. Make sure they take them regularly or on a regular daily operation, so that their bone system can be okay. And don't forget that calcium is also good for the brain, that is the nervous system. Transmission of information or neurotransmission of information is very important. So, and that's why you find that most of the aged people always sometimes tend to lose some brain focus, that is okay. Now, Greenwald's compound marrow powder, and the good thing with our institution or our profession is that most of these products can be easily taken by the elderly, because most of them are in powder form. Okay, so these are the products that can help. Number 1 is the Greenwald compound marrow powder that has manganese, has calcium, has zinc, has the important trace elements that your bone needs. to keep healthy. Then we have calcium capsule and also tablet. Now these ones can help you to satisfy your demand for the calcium. So these are the two now, but before we recommend this, you have to visit us for a scan so that we know the demand that is required. But before we administer this, we also need to detox you, because maybe you've been having arthritis and you've taken a lot of medicines, painkillers and whatever, and all those we said are toxins. Remember, we said toxin is any chemical or mixture that can cause harm to the environment or to the health. Okay, so we have to detox first. Okay. Then we also have other organs that we'll have to add on top of the major ones, on top of the calcium capsule or tablet, and also the compound marrow. We also need to add something. Now, according to TCM, that is traditional Chinese medicine, kidney channel govern bone and joints. So Greenwald kidney care capsule, either for men or women, also can be used for the prevention of osteoporosis. So once you are giving them this, it is also important to add the kidney tonifying, because now this one will help in the prevention of the porous bones. Okay, it will help in the prevention of losing the calcium from the body. Now, from calcium deficiency to osteoporosis to osteoarthritis is an ongoing process. So once our joints are also affected, we must add what is called the Greenwald Joint Health Capsule. Okay, yes, because it is a process which is still going on, so we add what is called Greenwald Joint Health Capsules. Now, remember, I always tell you that one thing I like about our profession is that the naming techniques which are given these products are easily can be useful in administering the medication once the person understands the medicine better. So that's all about osteoporosis. So osteoporosis due to calcium deficiency, that is a summary of it. And the products that can help in this: compound marrow, calcium, kidney tonifying, and joint health, but only after diagnosis and also after detoxification. Okay, now let's get to the second type of bone and joint condition. We talk about arthritis. Now, when you talk about arthritis, we have two types of arthritis. We have rheumatoid arthritis and osteoarthritis. So another common bone and joint disease is arthritis, which is a group of conditions involving damage to the joints of the body and characterized by the pain of back, neck, hip, knee, or feet. Pain. Now, I want to clarify something there. There is a difference between a disease and a symptom of a disease. Mostly a disease always attacks a body organ. When the body organ is attacked, it will emit some signals, some signs and symptoms. Now those signs and symptoms will always come in form of pain, discomfort, discharge, or whatever. Now when you talk about bone and joint, now the signal always come in form of pain, of which this pain can come from the back, can come from the neck, can come from the hip. That's why they always complain of back pain or neck pain, that is the shoulder pain. The hip joint pain. They can also have a complaint of knee pain, sometimes pain within the feet. Then you also have rheumatoid arthritis or osteoarthritis are the most common forms of arthritis, which similarly symptoms and different causes. So in many cases, you find that arthritis deprives individuals of their independence and also disrupts the lives of family members. Now, in general, that means people who get serious arthritis will have 10 to 15-year lifespan shortened. So guys, you need to take good care of this, okay? Now, let's see the difference. What's the difference between rheumatoid arthritis and osteoarthritis? Now, rheumatoid arthritis, from the table, we can see that rheumatoid arthritis and osteoarthritis share the same symptom of pain on the joints, but for the rheumatoid arthritis, it is the pain in smaller joints. So, and we are going to see what is rheumatoid arthritis and what is osteoarthritis, so that when you are coming for treatment, you need to know I have rheumatoid arthritis or I have osteoarthritis, okay? Now, it is the pain in smaller joints like fingers. When you talk about the pain wrist, we also have knees and elbows. And for osteoarthritis, it is the pain in larger joints like the back, hip, or also knee. Those we call them the larger joints, okay? So the cause of the two arthritis are totally different. They are not caused by one thing. That's why I'm still repeating, it is important to identify the root cause of a problem before treating it. Don't just recommend because this person has a disease, and that is where we go wrong. That's why people take a lot of drugs but they don't have any change, because they don't treat the disease from the root cause and they don't identify the root cause of the problem. So rheumatoid arthritis is an autoimmune disease. This one is an autoimmune disease. That's the cause. Immune system attacks the body tissues. Okay, it is an autoimmune disease caused by overreacting human system. While osteoarthritis, on the other side, is caused by daily wear and tear of the joint, just like a car tire. So as long as the car is always moving and braking and all that, there might be what is called wear and tear. Just the way you wear your shoes when you're walking every day, then your shoe might also have what is called wear and tear. That's why they age or they get old. So you have to replace or take it to a fundi so that it can be repaired. Now, rheumatoid arthritis is suffered mostly by people aged 20 and above. So this one, mostly in people aged 20 and above, okay? That is for the rheumatoid arthritis, while the osteoarthritis is commonly suffered by the elderly. Now, why we take the pain to differentiate the two types of arthritis? Because when you receive a complaint from your client, you must know which type of arthritis they are suffering from. I've told you this, so you will be able to give recommendation of the products. Now, characteristics of rheumatoid arthritis, an autoimmune disease. So as you can see, these a healthy joint from this side. These are muscle. These are your bones are inside. So the muscle. So those who are going for gyms like Kegel exercise, you have to develop the thighs. So these are the muscles that operate. Then we have tendon or ligaments, we have meniscus, we have synovial membrane, we have joint capsule, and then we have the bone inside. Then these are rheumatoid arthritis, an arthritis that has been attacked. Okay, so they have the inflamed tendon. So this side the tendon is okay, this side it has inflamed. Then we also have bone erosion, you can see on the other side. Then we have hyperplastic synovium, then inflammatory cells also there, then thinning of the cartilage. So rheumatoid arthritis is a kind of autoimmune disease, just the way I've said. So when body's own immune system starts to attack body tissues. And in rheumatoid arthritis, you find that this attack often occurs to the joint lining and cartilage, which eventually results in erosion of two opposing bones. So the two bones of the joints grind on each other, and you find that women suffer from the disease more easily than men. So you ask your patients whether they have morning stiffness, rheumatoid nodules, fatigue, sometimes associated with fever, which joints are attacked. If they tell you about small joints such as the fingers, wrist, knees, elbows, then you can draw a conclusion that this is a rheumatoid arthritis, which is an autoimmune disease. And we are going to see the solution. Now, let's go to characteristics of osteoarthritis, the second one, okay, which is the most common one, So we have a normal joint here. This is a normal joint. Then this a joint affected by osteoarthritis. Thinned cartilage, bone spur, osteophyte. Then we have cartilage fragments. You see there is a wear and tear. This one is smooth, but here there is wear and tear of the bones. So if your patient complain about swollen or maybe tenderness, swollen knees, okay, or tenderness or sometimes limitation of movement of larger joints of the body, such as the back, the hip is paining, the knee, and his or her age is younger, then it reminds you that this is probably osteoarthritis. So this disease is mainly acquired from daily wear and tear of the joint and often happens to the elderly. So thus it is also called wear and tear arthritis. Osteoarthritis is also called wear and tear arthritis. Note that one down. And grating cessation and bone spurs usually occur in osteoarthritis. So people are having friction within the bones. Wale wakitembea wakisimama mishipa inalia ama inakwaruzana, inamaanisha wako na osteoarthritis. It's the most common arthritis that people know outside here. Is there a solution to this? Yes, there is a solution. And arthritis is a very common disease in the world currently. So many people are suffering from arthritis, and more people are suffering from it. So whether for prevention or adjuvant treatment, then our products are the best choice. Now the first one is compound marrow again powder, and you also have calcium capsule. provides necessary nutrition to bones and joints. Okay, so compound marrow and calcium. So their function is to make sure that they provide necessary nutrition. Deficiency. We are talking about deficiency. Okay, so that they can operate properly. Then, as we said, according to TCM, kidney meridian governs bone and joint. So kidney care, either for men or women, are beneficial because they govern the bone and joints. They have what is called adrenal gland that secretes hormones, which is good for regulating the bone formation, bone reabsorption, and bone operation. Okay. Then we also have Greenwald cordyceps plus capsules, or Ganoderma plus capsules, or even we call it ginseng RHS capsule. So all these, the ones that I'm showing, I've told you there, or you can see them, are very good, helpful to regulate the immunity. Remember, we have said osteoarthritis is caused because of low immune system. So we recommend this one so that they can boost the immune system. Okay. Then we also add a joint health plus capsule, which is absolutely good and suitable for people with arthritis. It's called joint health. People having joint pain, joint health. So the reason why we'll have to add joint health, because it is good for people with arthritis, be it osteoarthritis or rheumatoid arthritis. So this is the second category of the bone problems, that is osteoarthritis and rheumatoid arthritis. So these are the products we recommend. But before we recommend these products, you have to visit us so that we combine or conduct a computerized diagnosis and screening so that we identify what the problem is. Then we give you the detox medication before we prescribe what is called the curable diseases. Okay. Let's get to the last one. It's called culprit of gout, purity. Have you ever seen people who are having inflamed legs, mguu zao zinafura na ukifinya inatengeneza shimo, then inarudi. Causes of diseases, I talked of excess uric acid. Yes. So the treating people nowadays varies. Just know the cause, remove the cause, tell him to or her to avoid the cause, then give the treatment, and this person will be okay. So now we want to talk about gout, which is due to excess uric acid. Remember, I said any dirt or any toxin that circulates with the blood is always deposited in the leg, because your leg is your body's dustbin. Now, the third common disease of bone and joint is gout, also known as metabolic arthritis. Metabolic arthritis, that's the other name for gout. And it is a disease which is caused by disorder of purine metabolism, resulting in elevated levels of uric acid in the blood. Okay, so it is characterized by recurrent attacks of acute inflammatory arthritis, also red tender, hot or swollen joint. Okay, now considered to be the most painful condition, this overload of uric acid deposits in joints, tendons, and also surrounding tissues, and thus will lead to joint inflammation. Now, pain out of shape of the small joint at the base of the big toe is the most common symptom of gout. Other joints that are commonly affected include the ankles. You know where the ankles are, somewhere there. That place where inafura hapo, the ankles. Then we have the knees, can also affect your knee. It can also affect your wrist and fingers and elbows. So this one is due to excess uric acid. Now, gout is 9 times more common in men than in women, mostly. Remember, we said osteoarthritis mostly and osteoporosis mostly is in women, but now men ndio wanapatikana sana na gout, because wao ndio watu wa nyama choma sana, mapombe sana na vitu kama hizo. Okay, and it predominantly attacks men after puberty and also attacks women after menopause. Now, it affects 1 in every 200 adults. Now, reasons cause buildup of blood uric acid, as you can see. So you need to know that the culprit of gout is in purine. Purine from food is oxidized to uric acid, and then the uric acid crystals cause inflammation, which leads to gout. And gout was historically known as the disease of kings or rich man's disease. Why? Because mesema wanaume ndo watu wa pombe na nyama choma sana. Things that we believe that only people who have money do that. Now, the overconsumption of alcohol, drinking too much alcohol, that's number one, okay, of alcohol. Then sugar, purine-rich foods such as red meat, nyama choma, seafood, organ meat, and dairy products contribute to gout to a great extent. Moreover, if you are in such conditions such as overweight or obesity, or maybe you are diabetic, hypertension, see, when you talk about diabetes, pancreas is involved there. Then high blood lipid, heart is also there. Bone marrow disorders, kidney damage, you see kidneys there. That's 6 crucial important organs zinajirudia tu, may also result in it. So at last, enzyme defects may also cause abnormal purine metabolism. So when your enzymes are not working normally, okay? So for people with gout, purine-rich foods should be cut or avoided, including asparagus, mushrooms, mushrooms, spinach. Those are things that we need to avoid. People, watu wenye wanafura mgumu skule spinach. Seafood, we also have food that are high in protein, as well as alcohol and soft drinks, hard and soft drinks. Avoid zile vitu kifungua inafanya very dangerous for our system. So for the lifestyles, people with the gout should quit smoking and also reduce the amount that one drinks. They also need to lose weight. They also need to eat sensibly. They also need to avoid eating purine-rich foods. They also need to avoid sugar, sweetened soft drinks, and alcohol. Then drinking a lot of water is very much important, so that things can also work better. So these are the foods which are good for gout and the lifestyle tips that I'm giving you, so that we can prevent this. Now, once you are affected with this and you come to us for checkup and diagnosis, then we'll have to detox. We'll have to detox your system. Now, this one are already toxins. These ones are already detoxifiers. So there is nothing we are going to detox again. They're already detoxifiers because you use them to remove excess purine in your system. So culprit of gout or purine, excess uric acid within the system. What's more, people with gout can take our chitosan plus capsules right here. You find that chitosan is always a product that is all over. But first of all, they need to make sure that they consume foods of low purine diet, and also they take plenty of fluid, especially taking a lot of water. Okay, so chitosan capsule to remove excess uric acid from the bloodstream. So the purpose of chitosan is to remove excess uric acid from the blood. Remember, I've told you, anything that circulates within the blood cannot function. So when you have excess uric acid, of which in our scan we see it from our screening machine, we have diagnosed our kidney. The kidney will show us whether you have excess uric acid. Now, before we treat your condition, we'll have to remove this, because this uric acid is in your blood. So once we give you calcium, then it won't function because of the excess uric acid in your system. Then number 2, we will add what is called a detoxing pad. Detoxing pad is here. It's like a bandage that you put in your leg. And if you can look at properly, it has vitamin C, which is a good antioxidant, and we also have botanical extract. It says chitosan again. The detoxing pad has chitosan. Then you also have bamboo vine jar. Okay, so the greenwald detoxing pad will help in removing excessive uric acid from the blood, and also you will have to add this one. It's called bone plaster. So the main function of the bone plaster is to ease the pain. Because obviously these people have to feel pain. They'll be feeling pain when they are walking. They feel like they are walking maybe when kama wanatembea kwa kokoto. Okay, to ease the pain of the affected joints, and also to accelerate the healing of the joints, because it is medicated. It will help you to accelerate the healing so that your joint can heal very fast. Then kidney tonifying is very important. You see, kidney is like as well as cordyceps. We have kidney. We also have another product called cordyceps plus capsule. So these ones will improve your immunity, and they will also help in strengthening the bone and the joint system. So ladies and gentlemen who are watching this video, make sure you drop a comment in something that you are interested in. If you have somebody you know who is suffering from these bone and joint care diseases, be it osteoporosis, be it arthritis, be it osteoarthritis or rheumatoid arthritis, or people having inflamed leg that when you press can make a hole, or such kind of things, then you can link them with us or with me, and then I will recommend the right treatment so that this person can have a proper treatment and a permanent solution for him. So to get in touch with us, make sure you get through my number. You can call, you can SMS, you can WhatsApp, you can get this medication from our nearest branch or from our branch near. We have branches in Kenya, we have branches in Africa, and we also have branches in Asia, Europe, and also America. So you don't have to do what is called online payment. You just contact me, I book an appointment with you with our specialist from our branch near you. You go there, get a checkup, and the medication will be prescribed from there, and you will thank me later. Otherwise, thank you so much, and I wish you all the best. So Greenwell Bone and Joint Care Package, let us dance together. Bye-bye. See you in my next video. This is your boy, Professor OJ. Now, parting shot, we usually don't encounter bone and joint problems overnight. So it is present for years before detection. So sometimes detecting them becomes difficult. So although none of these problems can be completely prevented, yet you can reduce the risk by lifestyle changes and conscious prevention. So more physical exercise will help you build strong and healthy bones and joints. Point number 1. 2. Take healthy food which are rich in vitamin C, D, E, and calcium. 3. Reduce the intake of food high in purine such as meat and seafood. 4. Limit alcohol and fructose consumption and avoid obesity. And always remember to keep your limbs warm. Sudden changes of temperature outside will stimulate the nerves surrounding the joints and boost functions of your kidney channel, which governs the bones according to TCM by using the kidney tonifying. And at last, do not forget Greenwell products are your good choice to maintain the health of our bone and joints. See you in my next video.